Did you know that a medication you probably take every day could be quietly harming your brain? Hello, I'm Dr. Margaret Ellis, a neurologist with over 15 years of experience, and today I want to share something that could change your life. Many patients come to my office worried about forgetfulness, confusion, and difficulty concentrating, thinking it's just normal aging. But what I almost always discover is far more alarming. The culprit isn't age. It's a medication they believed was completely safe. The most frightening part is that this medication is causing symptoms that mimic dementia in thousands of people, and nobody has warned them of the risk. As you watch this, millions of people around the world could be affecting their memory, focus, and ability to think clearly, without realizing the cause is in the pharmacy, not their brain. In this video, I'm going to reveal which medication is responsible, how it's affecting your brain, and what simple steps you can take to protect your memory and cognitive health. Stay with me until the end, because the information I'm about to share could save your brain before it's too late. According to the World Health Organization, over 50% of people over 65 take at least 5 different medications daily. This is called polypharmacy, and it's a ticking time bomb for your brain. Every medication you add to your daily routine exponentially increases the risk of dangerous interactions and neurological side effects. Here's the problem. Most of these effects don't appear immediately. They can take months, even years, to manifest. By the time you realize something is wrong, the damage may already be irreversible. It's like your brain is a candle, melting slowly, imperceptibly, until one day, you wake up and can't remember your grandchild's name. I'm going to reveal exactly which 7 medications are sabotaging your brain and what you can do to protect yourself. But first, let me tell you the story of Maria. Maria, a 67-year-old patient, came to my office convinced she had Alzheimer's. She had started forgetting entire conversations, asking her daughter the same question 3 times in an hour, constantly losing objects, and her family was preparing for the worst. Her husband had begun hiding the car keys, and her children took turns visiting daily. During the first consultations, all the symptoms pointed to age-related cognitive decline. Neurological exams showed some minor abnormalities, but nothing definitive. However, something caught my attention in her medical history. After multiple tests and a thorough review of all her medications, we discovered she did not have Alzheimer's. The culprit was a drug she had been taking for 3 years for seasonal allergies. A simple over-the-counter antihistamine had been blocking essential chemicals for her memory. 3 months after gradually discontinuing the medication under medical supervision, Maria had practically regained all cognitive function. Her family couldn't believe the transformation. It was as if she had awakened from a nightmare. This story happens more often than you think, and that's exactly why you need to know this information. What happened to Maria could be happening to you right now, and you might not even realize it. Let's start with the 7th medication on our list, benzodiazepines. Benzodiazepines, such as Klonpam, Dipam, and Lorazepam, are the most prescribed drugs for anxiety and insomnia. Brand names like Ribotril, Valium, and Ativan are probably familiar to you. These drugs intensify the effect of substances that slow brain activity, leading to intense sedation that impairs thinking, reflexes, and reaction time. Here's the problem. When used occasionally and for short periods, they can be beneficial. But when taken long-term, the real danger begins. Benzodiazepines can cause chemical dependence, making it increasingly difficult for the brain to function without them. A study published in the British Medical Journal followed over 100,000 patients for 15 years and found that those who used benzodiazepines for more than 3 months had a 51% higher risk of developing dementia. To put it in perspective, if normally 10 out of 100 people develop dementia, among chronic benzodiazepine users, it would be 15 out of 100. But the problem goes beyond statistics. These medications reduce neuronal activity, preventing the brain from forming new connections essential for learning and memory. It's like living in a house while gradually disconnecting the electrical wires. At first, only some lights go out, but over time, entire rooms go dark. The process is insidious. First, you notice it takes longer to remember names. Then you forget conversations from yesterday. Eventually, you may forget important events in your life. This decline can accelerate dramatically in older adults whose brains already have fewer reserves to compensate for damage. I remember a 72-year-old patient who had been taking clonazepam for 8 years for anxiety. He came to my office because his wife was worried about his memory. He told me he could no longer follow entire movies, got lost in conversations, and sometimes forgot the names of his own siblings. The most concerning part is that many people continue using these drugs for weeks or months without proper medical supervision, believing they are completely safe when in reality they may be irreversibly compromising brain function. Medication 6. Anticholinergics. Anticholinergics are extremely common over-the-counter medications used to treat allergies, colds, asthma, and even urinary incontinence. Some of the most well-known are diphenhydramine, Benadryl, ipratropium, and oxybutynin. You probably have at least one of these in your medicine cabinet right now. These drugs are literally everywhere. You'll find them in cough syrups, motion sickness pills, cold medications, eye drops, and even some over-the-counter sleep aids. People take them without a second thought because they're available without a prescription. The problem is that these medications block acetylcholine, a chemical essential for learning and memory. Think of acetylcholine as the fuel your brain uses to form new memories and maintain focus. When you block it, it's like removing the gas from a car. It can run for a while on reserve, but eventually it stops. This blockage can significantly impair brain function, making even simple tasks harder to perform. Studies show that long-term use of these remedies doubles the risk of dementia because the brain begins losing the ability to form new neural connections. A massive study published in Yamaha Internal Medicine followed over 30,000 people for 7 years. Researchers found that those who regularly took anticholinergics had physically smaller brains in areas responsible for memory. It was as if these medications were literally shrinking critical parts of the brain. The first signs that these medications are affecting your brain are lack of concentration, frequent forgetfulness, and mental confusion. Many people begin to suspect they are developing Alzheimer's when, in reality, the culprit may be a simple antihistamine or nasal decongestant used for long periods. I had a 54-year-old patient who worked as an accountant and had started making mistakes at work. She was convinced she was developing early dementia because she couldn't focus on numbers like before. It turned out she had been taking Benadryl every night for 2 years to help her sleep. 6 months after gradually stopping it, she had fully regained her mental sharpness. Medication 5. Statins. Statins like simvastatin, atorvastatin, and rosuvastatin are widely used to lower cholesterol and prevent heart disease. Brands like Lipitor, Crestor, and Zocor are among the most prescribed medications in the world. While highly effective for those who truly need them, long-term use can have concerning effects on the brain. Now, before you throw your statins away, it's crucial to understand that these medications save lives. For people at high cardiovascular risk, the benefits far outweigh the risks, but it's also important to know the side effects so you can make an informed decision with your doctor. The problem is that the brain needs cholesterol to function properly. About 25% of your body's cholesterol is in your brain, where it's essential for forming new neural connections and maintaining existing ones. When you drastically reduce cholesterol, you may inadvertently interfere with these vital processes. We know that long-term statin use can lead to memory difficulties and mental confusion in some patients. These people often report brain fog, difficulty concentrating, frequent forgetfulness, and loss of mental clarity. It's like living in a constant haze, where everything requires more mental effort than normal. Another problem is the impact on coenzyme Q10, a compound essential for energy production in cells, including brain cells. Since the brain is one of the body's highest energy consumers, any interference with this process can dramatically affect thinking clarity and learning ability. A study at the University of California followed statin users and found that up to 15% experienced some degree of cognitive decline. Interestingly, when some patients temporarily stopped taking statins under medical supervision, many regained normal cognitive function, suggesting the damage is not always permanent. If you're taking statins and notice changes in memory or concentration, do not stop them on your own. Talk to your doctor about adjusting the dose or considering alternatives. Supplementing with coenzyme Q10 may also help offset the deficiency caused by statins. Medication 4. Tricyclic antidepressants. Tricyclic antidepressants, such as amitriptyline, nortriptyline, and imipramine, were the cornerstone of depression treatment before the emergence of newer medications, like selective serotonin reuptake inhibitors. However, they are still widely used to treat chronic pain, insomnia, migraines, and certain neurological disorders. These medications were discovered by accident in the 1950s and revolutionized depression treatment. But what we didn't know then is that their mechanism of action, while effective for mood, can also have unintended consequences on other brain functions. The problem is that, in addition to affecting mood, they can compromise neuron function, leading to memory and concentration problems. These medications work by blocking brain chemicals essential for memory and learning, particularly acetylcholine, the same neurotransmitter affected by anticholinergics. It's like having a communication system in your brain with multiple channels. These medications tune the mood channel correctly, but interfere with the memory and focus channels. The result is that many people begin experiencing memory lapses, difficulty concentrating, and trouble recalling simple information. They may forget familiar names, lose track of conversations, or struggle to follow complex instructions. This effect is even more pronounced in older adults who are already at higher risk of adverse effects due to changes in metabolism and kidney function. A study in patients over 65 showed that 30% of those taking tricyclic antidepressants developed some degree of cognitive decline within the first 6 months of treatment. I vividly remember a 58-year-old patient who had been taking amitriptyline for 4 years to manage chronic migraines. She came to my office because she had started experiencing problems at work as a librarian. She couldn't remember the classification system she had used for decades and frequently forgot important conversations with her colleagues. Initially, both she and her previous doctor thought she might be developing early dementia. However, after a careful review of her medications and a gradual reduction of the amitriptyline, her symptoms improved significantly within 3 months. The good news is that there are more modern alternatives for most conditions treated with tricyclics. Selective serotonin reuptake inhibitors, SSRIs, for depression or specific migraine medications like triptans can be safer options for brain function. Medication 3. Corticosteroids. Corticosteroids such as prednisone, prednisolone, and dexamethasone are extremely powerful anti-inflammatories that come in pills, syrups, injections, and even creams. They are widely used to treat inflammation, joint pain, autoimmune diseases, severe allergies, asthma, and many other conditions. These medications are lifesavers in many situations. For people with rheumatoid arthritis, lupus, or severe asthma attacks, corticosteroids can be the difference between a normal life and debilitating disability. Their ability to reduce inflammation is extraordinary and, in many cases, irreplaceable. However, despite their positive effects in treating these conditions, they can have concerning consequences for brain health, especially when used long-term or in very high doses. The problem is that these medications don't just affect inflammation in the body, they also cross the blood-brain barrier and directly impact the brain. Long-term effects include mood changes, constant irritability, memory loss, and at higher doses, even psychotic symptoms such as hallucinations and delusions. I've seen patients develop what is colloquially known as steroid-induced psychosis, where they experience paranoia, extreme agitation, and a loss of touch with reality. This occurs because corticosteroids directly affect brain chemistry, influencing essential substances like serotonin and dopamine. They also interfere with the hippocampus, the brain region most important for forming new memories. One of the most concerning effects of long-term use is atrophy in specific brain regions related to memory. MRI studies have shown that patients on long-term corticosteroids have a physically smaller hippocampus, which can lead to symptoms indistinguishable from dementia. A Dutch study followed patients receiving corticosteroid treatment for 2 years. Researchers found that those who used them continuously had an 8% reduction in hippocampal volume, equivalent to approximately 2 years of accelerated brain aging. I had a 45-year-old patient with rheumatoid arthritis who had been taking prednisone for 3 years. He came to my office because his wife was concerned about dramatic personality changes. He had become extremely irritable, forgot important appointments, and had started experiencing episodes of confusion where he couldn't recall recent conversations. The key is responsible management. When corticosteroids are necessary, they should be used at the lowest effective dose for the shortest possible time. It's also important not to stop them abruptly, as this can cause a potentially life-threatening adrenal crisis. Medication 2. Modern sedatives. Modern sedatives such as zolpidem, Ambien, esopiclone, Lunesta, and zaleplon were developed as a safer alternative to traditional sedatives. Unlike benzodiazepines, these drugs were designed specifically to target only the part of the brain responsible for sleep, promising rest without the side effects of dependency and cognitive impairment. When they first came to market in the 1990s, they were promoted as the perfect solution for insomnia. Doctors prescribed them confidently, believing they finally had a safe option to help patients sleep. TV commercials showed people waking up refreshed and alert without any residual effects. However, current studies show that they can cause mental confusion, memory loss, and significantly increase the risk of falls, especially in older adults. A study published in the American Journal of Geriatric Psychiatry found that older adults using these medications were 32% more likely to experience serious falls. The problem is that, while they help you sleep, the sleep rhythm they produce is unnatural. Your brain doesn't rest as it should, meaning you're not addressing insomnia in the best possible way. It's like using a switch to turn off the lights, instead of letting the natural sunset gradually darken your room. During natural sleep, our brains cycle through critical phases: light sleep, deep sleep, and REM sleep. Each phase has specific functions. Deep sleep is when our brains cleanse themselves of toxins, including the proteins that accumulate in Alzheimer's. REM sleep is when we consolidate memories and process emotions. Modern sedatives disrupt these natural cycles, particularly reducing REM and deep sleep. It's as if your brain is in a semi-conscious state all night, never reaching the deep restorative levels it needs to function properly. During sleep, our bodies remain active, cleaning, repairing, and consolidating what we learned during the day. People who frequently use these medications may have severe difficulties remembering things and storing new information. It's like having a computer that never completes its nightly save process. I've seen patients who, after years of using zolpidem, develop what we call anterograde amnesia. They can perform complex activities like cooking or driving while under the influence of the medication, but the next day, they have no memory of having done them. Additionally, contrary to what was initially believed, these medications can cause dependence. Many patients find that after a few months of use, they cannot sleep without them, and when they try to stop, they experience rebound insomnia that can be worse than the original problem. Alternatives include cognitive behavioral therapy for insomnia, sleep hygiene, meditation, and in some cases, low-dose melatonin. These options can be more effective long-term without the cognitive risks associated with synthetic sedatives. Now we come to medication number 1, and I warn you, what I'm about to reveal will be extremely controversial. This medication is considered one of the safest and most effective in the world. Millions of people take it daily, and your doctor has probably never told you about this devastating side effect. Metformin is one of the best and most widely used medications for treating type 2 diabetes. It helps control blood sugar and improves insulin resistance. It is so effective that the World Health Organization lists it as an essential medicine, indispensable for any healthcare system. Diabetic patients benefit enormously from its use. Studies have shown that it can reduce the risk of diabetic complications such as blindness, kidney disease, and amputations. It is even being investigated for its potential to prevent cancer and extend longevity. However, long-term use without proper monitoring can have concerning consequences for the brain, especially because this medication interferes with the absorption of vitamin B12, an essential nutrient for brain health and nervous system function. Metformin affects the gut's ability to absorb vitamin B12, alters stomach pH, and interferes with intrinsic factor, a protein necessary for vitamin absorption. It's a subtle but cumulative effect. Each day you take metformin, your ability to absorb B12 is slightly compromised. Vitamin B12 is crucial for producing myelin, the substance that coats and protects nerve fibers. Without enough B12, these fibers deteriorate, causing neurological symptoms that can be devastating. It's also essential for neurotransmitter synthesis and overall brain function. B12 deficiency is associated with memory loss, poor concentration, and neuropathy in these patients. Symptoms can include tingling in hands and feet, weakness, extreme fatigue, balance problems, and in severe cases, paranoia and personality changes. In the most severe cases, neurons can suffer irreversible damage, resulting in symptoms very similar to Alzheimer's and other forms of dementia. The progression is slow but relentless. First, you notice you're more tired than usual. Then you start having trouble remembering names. Eventually, you could develop dementia that is completely indistinguishable from Alzheimer's. A Brazilian study followed 1,354 diabetic patients over 5 years and found that those taking metformin without B12 supplementation were 2.5 times more likely to develop symptoms of dementia compared to diabetics who were not taking the drug. The most shocking part is that this problem is entirely preventable. By simply monitoring blood B12 levels once a year, all these neurological issues can be avoided. It's a simple, inexpensive, and widely available test. Yet most doctors do not perform this routine monitoring. But how can you tell if any of these medications are affecting you? Here are the most important warning signs. Memory changes, forgetting recent conversations, names of familiar people, or where you placed everyday objects more frequently than usual. Difficulty concentrating, struggling to follow movies, read full books, or maintain attention in long conversations. Mental fog, feeling like your thinking is cloudy, or that tasks you used to do automatically now require more effort. Slower information processing, taking longer to understand instructions, solve simple problems, or process new information. Sleep disturbances, difficulty falling asleep naturally, or waking up tired despite sufficient hours of sleep. Emotional changes, unusual irritability, extreme mood swings, or loss of interest in activities you previously enjoyed. If you notice any of these signs while taking one of the medications we discussed, don't panic, but don't ignore them either. The first step is to make a complete list of all the medications you take, including over-the-counter drugs and supplements. The truth is, your brain is incredibly resilient. It has an extraordinary ability to heal and form new connections, even after damage, but only if you give it the chance. The key is not self-medicating, maintaining proper medical supervision, and staying alert to warning signs. Your brain is your most valuable asset, and protecting it must be an absolute priority. Remember, if you feel your mind is slower, if you frequently forget things, or if you have trouble concentrating, don't assume it's just aging. It could be the medication you take every day. Don't let a minor health issue become a major cognitive tragedy. Take control of your brain health today. I'm Dr. Margaret Ellis, and if you found this video helpful, don't forget to like and subscribe for more life-changing content. Share this video with your loved ones because this information could save their memory and their future. Remember, this isn't about demonizing medications. It's about using them intelligently. Every medication is a tool, and like any tool, it can build or destroy depending on how it's used. Your health is in your hands. See you in the next video.